So probiotics provide many health benefits, which I've discussed in a lot of previous videos. But in today's video, the side effects of probiotics that no one wants to talk about, I'm going to explain some of the potential problems that some people unfortunately can run into when they start taking a probiotic and how to overcome that, or at least minimize some of these unwanted symptoms. Hey there, I'm Dr. Hagmeyer, and I'm the clinic director here at drhagmeyer.com. And every year I work with hundreds of patients who struggle with just about every gastrointestinal problem that you can think of. And just about every patient that I work with at some point in their treatment program will be prescribed a probiotic. Now, most patients have zero problems, but let's say you are the 1% who struggles with taking a probiotic, but your gut is in really bad shape and you really know that you need to take a probiotic. Well, stay tuned because this video is for you. Start with a few side effects of probiotics, which is gastrointestinal symptoms. And in my experience, these symptoms often happen when someone has an underlying bacterial overgrowth or yeast overgrowth. For these patients, taking a bacteria-based probiotic like lactobacillus and bifidobacterium species, the most common symptom that these patients report is going to be bloating and gas. Now, for those that are taking, let's say, a yeast-based probiotic, like let's say Saccharomyces boulardii, the most common symptom that's going to be reported is an increase in constipation. Now, these side effects, to be clear, these are usually mild. They usually only last a few days. They often resolve on their own. Now, remember, living in your gut microbiome are bacteria and yeast, and sometimes these side effects are really indicators that your microbiome is shifting and changing, moving in the right direction. So those symptoms that are experienced, while sometimes uncomfortable, are not always a bad thing. Now, if you're someone who experiences these side effects when you start taking probiotics and it lasts more than a week, then what I recommend that you do is you cut your dosage in half or you switch brands. Now, the ideal situation is that anytime you take a probiotic, it's always best if you have a functional stool test from a functional medicine doctor that you're working with. And that's because a stool test can show what types of bacteria that you're going to most benefit from. But that's a whole nother video for a whole nother time. Now, another side effect of probiotics can be due to an increase in histamine. Some people suffer with just an underlying condition known as histamine intolerance, or MCAS, mast cell activation syndrome. Histamine is a chemical that we often think about during allergy season, right? Histamine causes your nose to run, your eyes to water, causes your skin to itch. But the histamine does so much more than that, especially when someone has a problem breaking it down. In the gut, histamine is broken down by an enzyme called DAO, diamine oxidase. And in the brain, it's broken down by something known as HNMT and MAOB, things I've done videos on. But here's the point. People with histamine intolerance have trouble properly breaking down the histamine in their bodies. And the reason I tell you all of this is because certain kinds of probiotics can actually increase the levels of histamine in your body. And for those people who are taking probiotics that contain these bacterial species, they can experience side effects caused by those probiotics. Now, I'm not going to mention all the different kinds of strains because I've written an entire article and an entire blog on this topic, and from time to time I do update this. But if you want to know more about histamine producing probiotic strains, I want you to go to the description box of today's video and I will leave a link there and you can go and check that on your own time. But if you suspect histamine intolerance, a symptom that you should be aware of when you take probiotics might include things like flushing, sudden or excessive sweating, you might experience hives, you might experience rashes, swelling, itchy skin, you may have a breakout, your heart may race, heart palpitations. But again, this isn't necessarily caused by probiotics, but it is exacerbated because of this underlying condition. Now, once these underlying triggers of histamine intolerance are addressed, very often these people can go back taking probiotics like everybody else. Now, if you suspect histamine intolerance, or you've been diagnosed with either histamine intolerance or MCAS, you'll want to select probiotic strains that have been shown to lower histamine levels, or at least take probiotic strains that are neutral. Now, if you're not sure if you have histamine intolerance, you can visit my website and look for the Histamine MCAS quiz. Again, I'll leave a link in the description box for that quiz if you want to take that. Keep in mind that many of the foods that we eat are considered probiotics because they contain live cultures of yeast and bacteria, things like yogurt and cheese and milk and miso and kimchi and kombucha. These fermented foods, while they have great healing properties, they also tend to be high in histamine, and so they can also cause symptoms for those that have problems breaking down histamine or have problems with the DAO enzyme. Now, if you notice that when you eat these foods or you take these probiotic supplements that I mentioned, you most likely have a problem with histamine, okay? Some of the other side effects of probiotics that no one really wants to talk about comes from biogenic amines. Now, biogenic amines really can excite the nerve system, the central nerve system, the brain. They can increase or decrease blood flow to different parts of the body. They can trigger headaches, anxiety, migraines. They can trigger flushing, abdominal cramps, uterine contractions. They can cause eczema, they can cause diarrhea, and they can even cause an increase in blood pressure. Many fermented foods are high in these biogenic amines. Again, these are going to be foods that are protein-rich foods that when they age or they ferment by bacteria, we basically are exposed to these things, and then we experience those symptoms. It's kind of hard to imagine that probiotics in food could cause these terrible side effects, but here's what you need to know. Food is powerful medicine, and sometimes we can use it to our advantage, and sometimes unknowingly, food can be bad medicine and it works against us. Now, if you notice when you eat these foods, you experience these symptoms, there's a good chance that biogenic amines are making you sick and contributing to your problem. And so you should opt for probiotic supplements that aren't going to increase those levels. One of the biggest problems with consuming fermented foods or even beverages is really not knowing what's in them. Now, I'm a big believer in making your own fermented foods for healthy people, and I routinely make several batches of kombucha every week or 2 weeks in my own home. But if you're someone who has IBS or inflammatory bowel disease or SIBO or leaky gut or some other kind of problem, I don't recommend that you eat many of these foods in the initial stages of your healing journey because you really don't know what you're getting. It's really like a crapshoot, right? You're better off taking probiotics with known species, known colony units until your gut settles down a little bit. Now, another side effect of probiotics is Dieoff, or what's called and referred to as a Herxheimer reaction. Now, Dieoff can occur anytime there's a drastic shift in the microbiome. Dieoff can occur when someone starts taking antibiotics. It can be when they start taking antiparasitics or antimicrobials, or even probiotic supplements. The cause of Dieoff is usually due to some sort of bacterial endotoxin or microbial antigen that gets released into the body. And it's believed that these toxins released from these dying pathogens, viruses, bacteria, parasites, and yeast, they begin to overwhelm the body's detoxification systems. In other words, the body's biotransformation pathways, like the liver and the kidneys and the gut, they can't keep up with all the release of toxins. So what you have is you have these problems that I mentioned. And so what's the alternative, right? So the thing is, you can still benefit from probiotics once your gut heals. And as I mentioned in the beginning of this video, I wanted to give you and share some tips with you if you're someone who's very sensitive. Number one is try taking your probiotic supplements with food, like breakfast. Normally, probiotics are best taken on an empty stomach, but taking a probiotic supplement with food can be a game changer for many people. Tip number two, phase probiotics in gradually. In fact, if you're really sensitive, you may even want to start with a soil-based probiotic, or also known as a spore-based probiotic, for a few months, and then transition into a yeast-based probiotic like Saccharomyces boulardii, and then finally into a bacteria-based probiotic like Lactobacillus and Bifido species. And of course, you want to do this over the course of a few weeks or months, gradually increasing the dosage. You may also want to try taking it before bed. Now, if you're taking a probiotic in a capsule form, here's what I don't recommend that you do. I don't recommend opening it up and then taking it in a different format than what is suggested by the manufacturer. So it's always best to follow the manufacturer's guidelines. Always keep in mind that not all probiotics are the same, and certain strains of probiotics suit different people for different needs at different seasons of their life. Now, if you work with a functional medicine doctor, he or she is going to be able to choose and make recommendations for the best probiotic based on your symptoms and also based on your test results. Now, my last tip for you, again, going back to histamine intolerance and MCS, my last tip is, again, going back to histamine intolerance and MCS, is if you were able to relate to the information about histamine intolerance, then in this case, it's best to take strains of probiotics that are going to assist in histamine breakdown, or at least, again, strains that are neutral. Again, go back and watch or read the article that I wrote on that subject material, because, again, that is being updated periodically. All right, so that's going to wrap up today's video on some of the side effects from probiotics and foods and supplements. One final thought that I have that I want to leave you with is this, is that probiotics are generally incredibly safe. 95% of people who have problems with probiotics, like the ones I mentioned in today's video, is usually due to some underlying problem, all right? But for those of you, I want you to know that for those of you who do experience these symptoms, I want you to know that you're not crazy. This can happen, and especially for those patients who have underlying health problems, this is something that we see. So again, you're not crazy. All right, well, I hope you enjoyed today's video. If you did, here's another video that I recommend that you check out right after watching this one.